Here to introduce our featured speaker is this year's program chair, Roy Mann. Roy?
Please welcome Dr. Chris Elias.
Thank you. Thank you, Roy, and thank you to Seattle 4 and the program committee for extending this invitation for me to speak with you on today, of all days, which is World Health Day. It's a great time to be back here to talk to you. The Seattle 4 has, as you know and as you've just heard, a very long history of supporting global health and PATH, and most recently through our partnership with the MASEPA program in Zambia, and we're very excited about that. But that's not where the history of engagement in global health began here at Seattle 4. Your Second Century Service Project is an impressive new initiative building on an extremely strong foundation. 2 weeks ago, I was in London and had a beer with David Heyman, the former director of the polio eradication program, who's now retired from WHO and working at the London School of Tropical Medicine and Hygiene. And we were talking about a variety of things, including the progress this year in polio eradication, his optimism that some of the most substantial progress is being made in India that we've seen in a number of years, and his optimism that India may be the next country where polio is eradicated. And we were talking about the critical role that Rotary has played in that, and the particular generosity of Seattle 4 as one of the leading and largest Rotary clubs contributing to that effort. So it's a tremendous honor to be here to help celebrate World Health Day and to recognize your achievements in global health and the work that we're going to do together in Zambia and many other places. The last time that I spoke here was in 2003, and as Roy said, much has happened since that time, and I'm not actually quite sure that I've earned the title Philosopher King, but I have become a million-mile frequent flyer, and that actually has better perks. There's been a lot going on in the last decade. I mean, the last decade could in some ways be thought of as the decade of global health. I think of it as the decade of the emergence of global health into the mainstream. When I moved here in 2000 to Seattle from Bangkok, Thailand, I had worked with PATH for over 20 years in different partnerships. And I was surprised how few people here in Seattle knew about PATH, and that reflected the sort of peripheral status that global health enjoyed at that time. Well, over the last 10 years, we've seen that change dramatically with the scale-up of the Bill and Melinda Gates Foundation, with the emergence of a tremendous community of people here in Seattle and institutions working on global health. PATH's growth is sort of emblematic of that. When I first came, we were in our offices on Nickerson. We had outgrown that space. We moved to Ballard 8 years ago. We outgrew that space, and just a few months ago, we moved down to our new offices at 2201 Westlake, at the corner of Westlake and Denny. We're now down here in Seattle 4 territory, and a number of you have pointed out that, what took us so long. We're greatly enjoying settling into our new headquarters. We had a unique opportunity working with Vulcan, and given the economic situation, to be into a great building that allows us to achieve our stewardship goals in terms of stewarding our donor funding, to create the kind of work environment that will attract and retain the best talent in global health, and perhaps most importantly, the adjacencies that we enjoy. We're 3 blocks from Seattle Biomed, 4 blocks the other way to Children's, 2 trolley stops from the Fred Hutchinson Cancer Research Center, 1 stop from the University of Washington's new campus in South Lake Union. The buzz that's in that neighborhood is palpable, and we're happy to be part of that community. We had an open house about 3 or 4 weeks ago, and we had 700 people show up. So you got to ask yourself, where in the world would 700 people show up to the open house for a global health nonprofit? And the answer is, I think, pretty clear. It's Seattle. It's the same town that has the world's largest Rotary Club and the 4th oldest club, and a long tradition of engagement in not only local civic issues but global issues, including global health. At that open house and in the hallway here, several people asked me, what's the most exciting? So much is going on. We've read so much and heard so much about PATH, your different collaborations with local Seattle businesses, with local nonprofits and universities. What's the most exciting thing you're working on? And I have 3 answers to that question. The first is sort of a strange response for somebody who lives in Seattle, and that is that I'm really excited that it's about to rain in Ouagadougou. Many of you probably have these iPhone apps. I've been tracking the weather in Ouagadougou, I'm happy to say that it's now partly cloudy there. The rains are due sometime in the next few weeks. And the reason that's so important is that Burkina Faso is right in the middle of the meningitis belt of Africa. And they are devastated every year with an epidemic of meningitis, typically between January and April. The rains stop it. There's something we don't quite understand about the transmission of meningitis in that region of Africa. But when it rains, the epidemics end. They've had a relatively mild epidemic this year, only 2,300 reported cases, and those cases are grossly underreported. This is a disease that causes severe morbidity and mortality, neurologic damage in those who survive. 10 or 20% of people don't survive. And the reason I'm excited about the rains this year is not only that will they stop this year's epidemic, but they may stop the last epidemic of meningitis A in the meningitis belt, in Burkina Faso in particular. And that's because 10 years ago, PATH formed a partnership with the World Health Organization and together approached and received funding from the Bill and Melinda Gates Foundation to develop a vaccine for meningitis A. And what it took to do that is sort of emblematic of what's been going on in global health for the last decade. We, a Seattle-based nonprofit, formed what essentially is a joint venture with the World Health Organization. That's not very common. We attracted $70 million of patient capital from the Gates Foundation with a 10-year horizon to develop and deploy a vaccine, taking science that's been around for 15 or 20 years and applying it to a bacteria that causes so much death in West Africa. We formed partnerships with companies in the Netherlands and in India. We've worked very closely with the Serum Institute of India to develop the vaccine. We transferred intellectual property from, of all places, the U.S. Food and Drug Administration to India, to the company. We supported FDA scientists to go to India, Indian scientists to come to Rockville and learn from the FDA. And they've developed a vaccine at a guaranteed price of 40 cents a dose. And that vaccine was just approved by the Indian regulatory authorities a few months ago and will be, it's pending approval from the World Health Organization, which we expect in June or July. And then in November, working again closely, and this time with the World Health Organization in the lead, we will begin the introduction of that vaccine in Burkina Faso, delivering it through mass campaigns that we know how to do because of the experience with polio and more recently measles. And if we achieve 80% coverage of the under 30 population in Burkina, which we think we will, the epidemiologic model suggests that next year's epidemic will not come, and we won't have to wait for it to rain. So that's the kind of exciting partnership that's emerged. You know, who would have thought 10 years ago that a Seattle nonprofit, the World Health Organization, the US FDA, an Indian company, a Dutch company, with support of the Gates Foundation, and as well as a number of other donors, would come together to put together a global public good at an affordable price and deliver it at scale. Very few people would have thought about that. But of course, Rotary would have thought about that because back in 1990, back 20 years ago, you formed a partnership with WHO, CDC, UNICEF to do an audacious thing, eradicate polio. And from 1990, where there were over 100 countries with polio, to today, where there's only 4, you've seen some similar results. The second thing I want to say that is exciting is the way I framed this was, you know, I have the best job in global health. Roy mentioned Plato. Not Plato, but like Plato, I was around at the right time. I think it was Jung in his work on synchronicity talked about how across the world in Plato's day, in disconnected places, there were intellectual emergence in South Asia and China and Greece similar ideas about humanity that were evolving. It was the time society and technology had evolved to a point where some of the bold ideas that Plato and Buddha and Confucius and others came up with, it was their time. And this is the time of global health, which is one of the reasons that I'm so excited to have the job I have. That said, the next 5 years will be the most critical years in global health. We've come off a great decade. We've seen unprecedented increases in political commitment. Who would think that G8 would talk about malaria? Some of them stumble over pronouncing tuberculosis, but they do it. We've seen great increases in resources. We've had the emergence in the last decade of the funding of the Bill and Melinda Gates Foundation. We've seen the U.S. government launch and sustain the President's Emergency Plan for AIDS Relief and the President's Malaria Initiative. There's been a 5-fold increase in U.S. government support for global health just in the last decade. In aggregate, and development assistance for health has quadrupled over the last 20 years. It doubled in the 90s, but then it doubled again in the last decade. We've also seen the emergence of new partnerships. The kind of public-private partnerships that I talked about with the meningitis example are typical. PATH today is involved in over 70 active partnerships with companies in the pharma, medical device, diagnostics, and biotech arenas. We've seen new pieces of global health architecture, the Global Fund for AIDS, TB, and Malaria, which has fueled a lot of the funded a lot of the bednet distribution and other things that the MSEPA program is doing. In many ways, the MSEPA program facilitates the government of Zambia taking advantage of larger resource flows that they receive from the World Bank, from the Global Fund, and from the President's Malaria Initiative. We've seen the Global Alliance for Vaccines and Immunization bring together the entire global community of interested parties to strengthen the delivery of new vaccines and existing vaccines, underutilized vaccines for the poorest countries of the world. And we've seen tremendous results. The aggregate under 5 child mortality rate in 2008 for the first time dropped below 9 million. Benchmark that to 1960 where there were 20 million kids a year dying. So for the first time last year in UNICEF's State of the Union report, State of the World's Children report, we saw reported deaths for under 9 million cases. More recently, if you look at the rollout of antiretroviral treatment for AIDS in Africa, just in 2003, less than 5% of the people in Africa living with HIV who needed treatment were receiving it. We're now up to about, by 2008, we're up to about 42%. We're about halfway there now. Now, we still got the other half of the way to go, and it'll be harder. But imagine going from under 5% to 50% of the people who needed HIV treatment receiving it just in the last 5 years. In Zambia, we've seen the child mortality rate drop 34% just from 2003 to 2008, again in a 5-year period, significant movement of the needle. And these are really just a sampling of some of the results that we're seeing across a broad range of infectious diseases and reproductive health indicators. But there are important challenges remaining. There's a palpable sense of impatience within the global community to realize its return on these recent investments. I sometimes liken the global health donor community to, they're like limited partners in a great venture capital fund that's in its 4th year. They've committed their money. They like the management team. The management team's made some great bets, and they can't wait to see those returns start coming in. And we're under some time pressure. In 2015, when the Millennium Development Goals come due, that will be a year of reckoning to see whether those ambitious goals that 191 nations set in 2000 at the Millennium Summit are realized or not. If we look at progress, and this is an important year, we're 2/3 of the way there, many countries are on track, but many countries aren't, and we've got a lot of work to do in the next 5 years. One of the things that's happening as a consequence of that is what I call the paradox of progress, that inequity, health inequity, tends to get worse before it goes away. That as we succeed in the better governed and better resource places, the problems become concentrated in less well-governed and poorer places, and that has implications for our strategy. You're obviously quite familiar with that. As polio eradication has proceeded, you've gone from over 100 countries to 4 countries, and those countries are Afghanistan, Pakistan, the poorest parts of northern India, and northern Nigeria. So the problems get concentrated, and the efforts have to get concentrated as we proceed. When we think about the Millennium Development Goals, particularly goal number 5 on reducing maternal mortality, if anything's more stubborn than polio, it may be maternal mortality. In 2005, the lifetime risk of dying in childbirth in the United States was 1 in 4,800. In Mali, it was 1 in 15. And the progress of reduction of maternal mortality is there. There is some movement, but it's not moving fast enough. It's the Millennium Development Goal that lags the most, which has this tremendous sense of coming off a great decade but having an impatient and challenging hill to climb yet has informed our work at PATH. We've recently completed a across-the-board strategy process to think about how PATH, now that we are the second largest nonprofit in the state of Washington, we're one of the larger nonprofits in the global health arena, how do we contribute to the global enterprise in reaching these ambitious goals over the next 5 years? And we're really going to focus across our vast array of programs on 3 key things, which I'll illustrate for you. The first is what we call accelerating interventions. When we started talking to people about what we needed to do next, they said, we love what you do, you just need to do it faster. And so what we want to do is to take a careful look at our projects and to think about how we move life-saving interventions more quickly from the laboratory bench to the hands of the people who need them, without compromising quality or cutting corners, but making sure we've squeezed all the inefficiency out of that invention, testing, and delivery process. Secondly, we need to expand our reach, reaching to the most vulnerable populations in the countries where we currently work, but also positioning ourselves in new countries where these disease burdens are becoming more concentrated. Thirdly, we need to achieve scale. The MASEPA program is a wonderful example of how we take an integrated set of health interventions and scale it up for national impact. That's important not just to touch more lives and save more children. It's also important to produce the evidence that is going to be absolutely required in London, Washington, Tokyo to sustain the political and financial commitment to the global health enterprise. If we don't start returning results at scale, not just successful things in boutique projects in small villages, but really national scale success, I think, given especially the economic recession, that the political and financial commitment may be at jeopardy. So let me just give you an example of how we're going to do those things. In the accelerating interventions arena, one of the best examples is our work on the malaria vaccine that's known as RTSS. We have a collaboration with GlaxoSmithKline in testing what is now the most advanced malaria vaccine, the first, in fact, to proceed into large-scale clinical trials, and the first to be seen likely as actually getting through approval and be put into use. It's a complex partnership with GlaxoSmithKline, with 11 research sites throughout Africa, supported by the Bill and Melinda Gates Foundation, the U.S. government, ExxonMobil. It involves a trial of complexity that when I went to public health school, didn't talk about. It involves 16,000 children in 11 trial sites in 7 countries. It's the largest preventive vaccine trial that's ever been done on the African continent. My favorite symbol of its complexity is that to get the protocol approved, we had to take it through 40 different ethical review committees. Each one of those 11 trial sites, typically a local committee and the university committee it's affiliated with, the WHO, the FDA, the EMEA, our committee, 40 ethical review committees. Some of who said, well, change this sentence. And it's like, oh, no, we got to tell the other 39 they want to change. But it happened. The trial got approved, and it's currently underway. We have about 9,000 children that are currently enrolled to a total number of 16,000. And if you think about where the opportunities for accelerating that are, there are multiple opportunities in how we built the capacity of those clinical trials, tested them so that they could begin enrolling children as quickly as possible. In parallel with that, we've been working with since the vaccine's made in Belgium, we've been working with the European regulatory authorities on something they call Article 58, which is their new fast-track mechanism for reviewing vaccine applications. This malaria vaccine will be the first one through that fast-track regulatory process. And we've begun, in our partnership with GSK, we've negotiated some very attractive terms of what we call global access. Andrew Whitty, the CEO of GSK, announced these a couple of weeks ago at a speech at the Council on Foreign Relations, where he talked about how, once approved, GSK will donate 12.5 million doses of vaccine to PATH, which we will use to kickstart the introduction, and that they will also price the vaccine at no more than a 5% profit margin over their costs, which will make it affordable for groups like Gavi and the Global Fund to purchase, even in a tough resource environment. But even then, while we're probably 3 years away in the most optimistic scenario of completing the trial and getting the vaccine approved, today we're working in 7 countries in Africa to prepare what we call the decision-making framework, working with national policymakers to understand what information they need about their refrigeration and cold chain, about the efficacy of the vaccine, so that the day after the vaccine's approved, it will go into use, not get approved, spend a year planning, and then put it into use. So accelerating interventions by collapsing, wherever possible, the timeline for going from innovation to impact is an example of what we want to do. This project is the single largest investment that the Gates Foundation has made in PATH. They've committed over $500 million to our malaria vaccine work, and for this clinical process alone, almost $200 million. And Bill and Melinda like to describe themselves as impatient optimists, and so we're sharing that impatience and optimism to try and show a return on that investment as soon as possible. In expanding reach, another thing that we'll be doing is strengthening our field presence so that we can reach more people in those countries where we already are positioned, and to strategically position ourselves to make sure we're addressing the hardest problems. So just to give you a sense of how the disease concentration occurs as we start succeeding elsewhere, there are 5 countries in the world that harbor half of the world's vaccine-preventable diseases today. There are 6 countries in the world that have half of the maternal deaths. And there are 8 countries that have half of the new HIV infections. Now that represents actually, ironically, something of a success, because we're succeeding in other places and perhaps easier places, and that's why we're seeing the concentration. PATH currently works in most of those countries, but when we think about how do we optimally deploy so that we're playing the role that we can in the global health enterprise, we need to strengthen our field presence in some places where we're relatively new, like Ethiopia and the Democratic Republic of Congo, and we need to extend our operations into countries where we currently don't have field operations, like Nigeria and Pakistan. The final thing is achieving scale, and the MSEPA program is a very good example of this, and Jim and Anna and Roy will see this in a couple of weeks for themselves, and you've heard about it from my colleague Kent Campbell, who spoke here last summer. Just to give you a few indicators of that, back in 2006, PATH, through the MSEPA program, supported Zambia's first national malaria indicator survey, and we repeated that 2 years later in 2008. And we saw just in that 2-year period a 50% drop in the parasitemia, the levels of malaria in children's blood under the age of 5. And related to that, and causally related to that, was a 50% increase in the number of Zambian households that were covered by at least one insecticide-treated net or recently sprayed with insecticide. This kind of result, again, is the kind of result that we're going to need to achieve, both contributing to that 34% drop in child mortality in Zambia, but also documenting that evidence, to present that evidence in Washington, to continue support for the President's Malaria Initiative, and in other capitals to continue to garner their support. So we're very excited about our partnership with Seattle 4. I'd particularly like to thank the steering committee and members Nancy Slater and Steve Crane and others for your support as we take on this important challenge. And so in closing, I want to talk about the third thing that I find most exciting, and that's landing at CTAC. More importantly, being part of this community here in the Northwest. I may not be a philosopher king. I actually don't think I am. Because I remember Plato, didn't he? They just sat on the hill and slept until somebody asked them for advice, right? That's not what I do. But like Plato, not only am I living in the right time, I'm living in the right place. You know, Athens was the crossroads of trade back in Plato's day, and Seattle is obviously a very important crossroads for trade and for a lot more people in global health who come through Seattle now than they did a decade ago. Seattle has really become what we are calling increasingly a global health nexus. It is a concentration of civic society, civil society, universities, engaged businesses, great philanthropy, et cetera, that has created a critical mass here that has put us in the position in global health that where we can really change things. If you think just about the people that I can walk to in 5 minutes from our new office, the Seattle Biomed, where we're collaborating closely on the next generation of malaria vaccines, the Fred Hutch, the University of Washington, IDRI, a variety of, every time I do this list I forget people and they get mad at me, but all those people, many of whom are part of the Washington Global Health Alliance and many of whom are here today. Just over the hill from us, the Gates Foundation is completing its nearly 600,000 square foot headquarters in South Lake Union. And of course, the Seattle 4 Club is leading the way for other Rotary clubs around the world in understanding how service above self can address persistent global health problems. So I want to end with just an anecdote about when I was in London 2 weeks ago. For the last couple of hundred years, at least, London has been a global health nexus. So when I met David Heyman at the London School of Tropical Medicine and Hygiene, he said, well, let's not stay here at the London School. Let's go to the John Snow pub, which is a short walk away. And those of you who know, John Snow was one of the fathers of epidemiology, and he was famous for having been one of the first people to track the source of an epidemic, and he tracked it to the pump on Broad Street in Soho as the cause of a serious outbreak of cholera in London, and he is most famous for having gone to that pump and taken the handle off of it. And so it's still there, right outside of the John Snow pub is the pump without a handle. And he became famous in that global health nexus for both showing that diligent thought and epidemiology could lead the way to tangible improvements in global health. And so 150 years later, here in Seattle, using perhaps a different metaphor, one could say that by dimensioning our aspirations more to the size of the problems, less to the constraints, by innovating a set of partnerships, public-private, NGO, government, university, business, etc., and unleashing an entrepreneurial zeal that has been part of this part of the United States ever since it was settled, we're in some ways putting the handle back on the pump that's fueling the global health revolution, and it's just wonderful to be a part of it and wonderful to see your interest and to have you to have a chance to be here with you today. So thank you and happy World Health Day.
We have time for questions. If you have any, please look for the folks with the microphones.
Yes, can you tell me if you have meaningful opportunities for volunteers?
Depends on what you define as a meaningful opportunity for volunteers. We're very interested in engaging people. One of the ways we do that is by having people come to our headquarters to see what we do. These almost twice a month we do these tours through our facility, get people to understand our work, see what the opportunities may be. Some of the best opportunities for volunteer are actually through partnerships with organizations like Rotary. I mean, I think this, the project you heard about from Nancy and Jim is a very good example. We don't engage a huge amount of volunteers in our programs directly, but we often partner with groups like Rotary. We've worked, in Burkina Faso, when we do that mass immunization campaign in November, we're going to have every Peace Corps volunteer helping to do it. We've talked to the Peace Corps, in Ouagadougou about being part of that effort. So often it's through engagements with service organizations that, as partners, that we're able to create opportunities for volunteers. Yep.
I see a lot of growth in this nexus that you're talking about in Seattle. What are the things that we need to do to make sure that we don't lose the synergy of all of these organizations? What are the places where the city and our citizens here can support the growth of your cluster?
I think that there's a couple of, there are a lot of things. One is that we have, in partnerships with a number of small businesses here, having a vibrant small business community. We're working with Cascade Designs on their water technology. We're working with a number of other local companies. I think one of the most important things we can do as citizens is actually strengthen the education. The K through 12 education in particular needs some serious work, as you all know better than I. But that sometimes comes up as an issue in recruitment. People say, we love Seattle, we went, we saw, we were there on a non-rainy day, we even went skiing, but we read this thing about your public school system. Similarly, we've got great research universities that aren't faring as well as they need to in the current budget situation. They do a very good job bringing in funding from NIH and others, but so support to both K through 12 and university education, I think, would be important for us. I think as the city, I think that there are some specific things that are happening already in terms of creating sort of an innovation zone within South Lake Union. I'm not fully steeped in the details of that, but I think there is really, we've seen this just in a few months of moving from Ballard to South Lake Union. There is a tremendous amount of synergy that comes from just the simple adjacencies of being together and creating and building on that hub, both for life sciences generally as well as for global health, I think is a tangible thing that the city could do.
Thank you for your talk. There's obviously a lot of benefit from surgery, or at least there has been in this country. And surgery is clearly a very hazardous thing to have in most developing countries. And there's certainly evidence coming from Dean Jameson's and other people's work that it's good value for money. Can you give us some kind of summary of what kind of progress has been made in making safe anesthesia and safe surgery available?
Not enough is the simple answer. I mean, I think Dean and others have been showing that not just in surgical diseases requiring surgical intervention, but also the coming tidal wave of chronic disease more generally, and in injuries in many places as globalization and urbanization occur. Last year was the first time more people lived in cities and that's going to just go up from there. There's more and more, about 10% of the world's disease burden now is injuries. Many of which require surgery, at least acute trauma care, and that's not available. And unfortunately, part of the challenge, and this has, I think, gotten a little bit worse with the recession, there's a sense in most of the global donor community that we need to finish the current agenda, that especially with scarce resources. We're very interested at PATH in seeing how we could bring some of our models of public-private partnership, et cetera, to chronic diseases, injuries. There are a number of interesting pilots that I think are going to, like Paul Farmer's doing some interesting work with surgery in Haiti. There are a number of other interesting pilots, one in Ghana that I know of, where we're going to start producing the data that, as Dean has indicated, is cost effective. So there's a sense of, it's kind of where we were 20 years ago with malaria, people said, or polio. People said, well, it's such a big problem, we can't do anything about it. And so it takes the kind of partnerships and resources and leadership that Rotary and others have brought to polio, that we and others are bringing to malaria, that hasn't happened yet. So what we have now are some boutique projects that are showing promising results, and I think will help produce the initial evidence that this is a worthwhile, cost-effective investment. But there has not yet been a significant investment from any of the major global donors in either injuries or chronic diseases globally.
As we applaud and root for your continued success, my question goes to, if we increase the longevity of the world's population, how do we feed them?
That's a good question. There's really two answers. One is that the data are very clear about the demographic transition. That that if we improve people's health, that there'll be a drop in fertility. So it's not like there will be necessarily an ever expanding population as a consequence of improved health. That said, the population is going to increase from its current 6.5 billion to probably 8.5 to 9 billion minimal by 2050, mostly because that's an age structure issue. That's population momentum. It's even if, I'll put it this way, if every couple had 2 kids tomorrow, we'd still go to 8 billion because of the fact that half of the world's population is under 25 and just coming into reproductive age. So we have a food security challenge that is real and is only partially affected by improvements in health. In fact, I would argue that improving health will help to bring fertility down faster and reach us to a smaller stable population globally than if we don't improve health. That doesn't solve the food security problem, and there are important new efforts. I mean, the U.S. government has announced 2 new efforts within the last year. One is the Global Health Initiative, the $63 billion global health plan that the Obama administration has introduced into Congress. I'm much more familiar with that than I am their other one, which is the Food Security Initiative. And there are, I know, very intentional efforts within the U.S. government to try and link those so that so you're right. I'm not personally able to speak to the details of what we need to do about food security, but I would say very strongly that improving health is going to make that problem easier to deal with, not worse. Okay, great. Thank you.
Thank you very much, Doctor. We're so appreciative of you joining us today and for your and PATH's work to ensure access to good health throughout the world. Thanks again to all of today's program participants. Next week, April 14th, we're going to stay right here at the Grand Hyatt. Roy, who are we going to hear from next week? Dr. Johnson. That's okay. Roy didn't know I was going to do this, but one thing I can guarantee you, it'll be a fabulous program. With today being World Health Day, we know we enjoy so many health advantages in this country. However, one of the not so good things that it seems we've cornered the market on is stress, especially in these times. Stress is something that I've always tried to deal with, so I'd like to share a few tips written by Cleveland author and journalist Regina Brett that sounded pretty good to me. Life isn't fair, but it's still good. When in doubt, just take the next small step. Make peace with your past so it won't mess up the present. Don't compare your life to others. You have no idea what their journey is all about. It's okay to get angry with God. He can take it. And don't take yourself so seriously. No one else does. Thanks for being here today. Be sure to take care of you. We're adjourned.
Seattle Rotary Online is made possible in part by a grant from First Choice Health, working with the Washington Health Information Collaborative to use technology to bring better health care to patients throughout the Pacific Northwest. First Choice Health.